Hello, my name is Marika Sandrelli. I work in the role of Knowledge Exchange Leader in Fraser Health in British Columbia, Canada.
And hi, my name is Stephanie Knack. I'm a senior research consultant with the Mental Health Commission of Canada. What we want to talk to you today is about a training program called TRIP and how it helps to reduce stigma among health professionals towards people who use substances. Now, we know that stigma is a huge barrier for people who use substances in accessing and receiving quality health and social care. We also know that many people who use substances intentionally avoid seeking services for fear of being stigmatized or because of previous negative experiences with the health and social care systems. One identified source of stigma is occupational stress and burnout. And previous research has suggested that providing resources and tools to help health providers better manage their experiences of stress and trauma and burnout may be one way of reducing stigmatizing behaviors towards patients. Another important and promising way of reducing stigma and building trust for people who use substances in their interactions with the healthcare system is to build models of care that are trauma informed. The program we're going to talk about today, TRIP, does both of these things.
The goal of trauma and resiliency informed practice is to reduce the effects of past and current experiences of violence and trauma to avoid re-traumatizing patients, clients, families, natural supports, and service providers themselves. Originally known as trauma-informed practice, starting in 2013, training was implemented with service providers and evaluated in Fraser Health. After 5 years, evaluation data showed that for some participants, the very act of engaging in TRIP training activated the effects of trauma. They disclosed experiences of distress from realizing how much they were hurting clients, while it being impacted by workplace trauma themselves. Participants described being angry, frustrated, or shut down when engaging with clients. What they shared resembled stigmatizing behaviors. This further created dissonance and in turn increased distress. Thus, mindful self-compassion and resiliency training components were added using a common humanity framework. And TRIP, trauma-informed practice, became TRIP, trauma and resiliency informed practice. Since then, TRIP development has become a workplace strategy that includes training and a regional community of practice to enforce learning and continuously develop skills.
In 2019, the Mental Health Commission of Canada partnered with Fraser Health to evaluate the TRIP program based on its promise for reducing stigma. So this program has now been evaluated 3 times in 3 different contexts within the Fraser Health region. And in all 3 evaluations, we saw statistically significant reductions in stigma towards people who use opioids. The biggest improvement we saw was in the training with ER staff. And in that same evaluation, fully 91% of ER staff said that as a result of the TRIP training, their behavior towards patients who use substances would be different, with most saying that they would now approach patients with more understanding, more empathy, more compassion, and less judgment, and that they now had better ways of interacting, communicating, and listening. And we've seen these same kinds of results across all of the different evaluations we've done.
From facilitating TRIP, I remember a lot of disclosures, but one in particular stands out, and it's from an emergency room nurse. And she said, and I quote, "I thought it was going to be all touchy and feely and not science, and not getting to the point of what I really need to work in an emergency room. But now I realize what I need to do is connect with what I'm feeling in the present moment and to attune to others so I can be receptive to helping that patient in front of me. And that is hard science." We did it in the workshop space over computer screens using Zoom, so at least I can try it in person in the emergency room. So for people who've overdosed or at risk for overdose, asking for help is one of the hardest things to do, let alone feeling judged, misunderstood, disqualified, or less than when they do risk reaching out for help. For many, that stigmatizing experience is enough to not go back at all, which during this crisis can be life-threatening. TRIP has demonstrated that it can promote compassion for others toward a more engaging, safe, and inclusive service culture where stigmatizing behaviors cannot hide nor survive. Fraser Health and the Mental Health Commission of Canada is working together to make this TRIP program more widely available across Canada. Thank you.
Thank you.